Welcome to the I Choose Health podcast. I'm your host, Stephen Leslie. Today, we have fitness trainer and certified breathing coach, as well as Pessary instructor, Gaynor Morgan, joining us on the show. Is something interfering with your happiness or preventing you from achieving your goals? There is definitely something keeping me from my happiness and accomplishing my goals. I needed to take stock of my depression and consistent negative self-talk. Therapy helped me realize that I was deserving of happiness. That's why this podcast is called I Choose Health. It was about me choosing happiness, and I wanted to share that with you. That's why I wanted to and have partnered with BetterHelp as a sponsor to share the gift of therapy with you. Over 4 million people have used BetterHelp to start living a healthier, happier life. People spend hours in the gym every week. So why not give your mind the same kind of attention? Starting therapy can be hard. The right therapist for you may not be in your area, and some people find the face-to-face interaction of therapy uncomfortable. With BetterHelp, you can have your therapy sessions as a phone call, as a video chat, or even via messaging if you prefer that. Whatever is the most comfortable version of therapy for you. BetterHelp can match you to one of over 30,000 therapists in their network, which gives you access to a wider range of expertise that may be available in your area. To get started, you fill out a questionnaire to help assess your specific needs, and then you'll get matched with your therapist, in most cases within 48 hours or less. You'll be able to schedule therapy sessions at a time that's convenient for you. If the therapist you're first matched with doesn't feel like the right fit, which can be common when starting therapy, you can easily switch to a new therapist at no additional cost without stressing about insurance, who's in your network, or anything like that. If you think you might benefit from therapy, consider BetterHelp. Click the link in the description or visit betterhelp.com/iChooseHealth for 10% off your first month with a licensed therapist. All right, welcome back to the I Choose Health podcast. I'm your host, Stephen Leslie. Guys, we're really stoked to be back with you again. And, as I've said in the last couple of episodes, we've really been trying to spend a little bit more time highlighting, issues, particularly within women's health, definitely because I feel like it's really neglected. I've been a personal trainer for about 3 or 4 years now, and at least 60 to 70% of my clients are women. And I've noticed that there is not enough specific programming towards women. And, every person is different. And, we have specified programs for each individual. And it's important to understand that for women, there are going to be different ways that different things affect them when they're trying to accomplish different goals, whether that is losing weight or gaining muscle, whatever it is they're trying to do. There are going to be different things, maybe at a hormonal level, or different things that could also affect them from being able to to achieve their goals. So I've been really thankful, for everyone that we've had on the podcast, and I want to introduce today, fitness trainer, also certified breathing coach, and I know she told me the right term, but also Pessary instructor, Gaynor Morgan. She's on the show with us today. How are you doing, Morgan? Gaynor.
Hi, hi, Stephen. Thanks for having me. Yeah, it's a bit difficult because Morgan is a first name in the States and Gaynor is a surname, but over here, Gaynor is my first name. But you'll be forgiven. Right. That's okay. Call me what you like. I'll answer to anything.
Okay. Got it. Well, guys, just, let me know. I know you've been in the fitness field. I know you said for about 25 years now. Or at least 25 or more. What led you into this field, and what were you doing prior to this?
So I've had an amazing life. I started off my career where I left school and I was nursing, and then I went nursing in London. And then I had an operation. No, I had an opportunity to become an air hostess in the Middle East. So I spent 12 years in the Middle East working as an air hostess, and then became an instructor for safety and survival. And towards the end of the 12 years I'd spent in the Middle East, which was amazing, a fantastic part of my life, my own mother had been diagnosed with urinary stress incontinence. She'd had a TVT operation, which is a small mesh tape that lifts up the bladder and the urethra. So those of you who are listening, the urethra is that small tube that lets urine out of the bladder, and it's a lot shorter in women than it is in men. This is why women end up with a lot more bladder infections than men, because the bacteria has got a shorter distance to travel. And so Mum, she was okay for about 5 to 8 years, and then she started to get really depressed, and she was treated for depression, but not the root cause. The surgery, I can't say it failed because it just stopped working, and that made her depressed. She, Mum was very young. She had me at a very young age, so we grew up very close sisters, and she was also a nurse. And she stopped her relationship with her partner at the time because every time they were intimate, she basically leaked urine, and she couldn't have that going on. So, cut a long story short, we came up with the idea that if there was any kind of pressure that was exerted onto the urethra, that would control the involuntary loss of urine. Now, both of us with medical backgrounds and sort of getting our heads together, Mum had said, when I'm menstruating, I'm not leaking urine. And then we had this moment of, crikey, what if we could make a washable tampon? That would solve a lot of problems. And we did that. We were in the living room and we had all these molds going on, air drying. Stay with me here because I promise you it's relevant to later on. Air drying clay, and we immersed a candle for the shape and a McDonald's straw. That's literally what we had in the living room, and a keychain. So we put that in, we piped silicone into it, and then the silicone dried, and we had our mould. We had our very first Pessary type. And I've got one here, so it looked like that. It's changed shape a little bit. And so Mum put a condom over it for hygiene reasons, and she wore it, and she said, I'm not leaking urine. I'm going to carry on finding a way to get this onto the market. And we did. So first of all, if anybody's thinking about using any of the tampons, whether they're organic tampons or cotton tampons, please do not use that outside the recommended use. So do not use them in place of a pessary, because it can cause toxic shock syndrome. So we went off and we had prototypes made. We had clinical trials made for what was then called the Inco Stop and became Inco Stress later on. Now, sadly, Mum passed away in 2004, so she missed the clinical results where we had 85% of women coming off the waiting list to surgery and using this little pessary. Anyway, that went global, and then I got involved with advising different manufacturers. I became a manufacturer of this product and went on to develop other products then for prolapses, not just incontinence. Fast forward again, I ended up with Erectocele. So Erectocele is a prolapse where the rectum, the bowel, starts to protrude into the vagina. And I saw loads of doctors and they kept saying, well, surgery is the only thing that is suitable for you. So now we're in 2009 and I met an amazing urogynecologist called Dr. Bruce Crawford, who has the fitness program called Pilates. So it's PF, pelvic floor Pilates. And I started doing that, and I noticed with some of my own methods as well, I started to get a reduction of this prolapse. I also had stress incontinence as well, and that had disappeared. So I went further on to have nutritional advice because I had chronic constipation, which usually goes hand in hand with Erectocele. I also had physiotherapy treatment as well. So over the course of 18 months, I've gone from a stage 2, so prolapses come in 4 stages. Stage 1, you probably don't even know you've got one. Stage 2 is where if you put your fingers inside the vagina, those of you are not afraid of your own bodies, you can feel it just inside the entrance. Stage 3 is where it protrudes outside, and stage 4 is an eversion where it can fall down about 8-10 centimeters outside of the entrance. So, there's quite a big difference between the stages. So I went from stage 2 to 0 and never needed surgery. Now, that's not to say that later on down the line it's going to happen again, because there will always be that sort of laxity inside the vagina. But I then went on to become a fitness instructor with Dr. Crawford, teaching his program, because it worked for me. And then I continued to learn more and more, and I started to give lessons then to medical professionals in pessary training, because around about 2009, 2010, pessaries was still a very unknown market. They were out there, but nobody knew about it. And so that kind of grew. At the same time then, I started to do other fitness instructor certificates, and then COVID broke out, and I did my bleeding instructor course with Yoga Body, and then I went on to do the Ibuteyko breathing, and then with the amazing David Jackson, I'm off doing his retreat in March. So again, with pelvic organ prolapse, anything with the pelvic floor, it has a direct correlation with what's happening in the jawline and certainly what's happening in the diaphragm. So when you have a fitness program that will address your jaw, your breathing structure, and the fitness around it, you're basically correcting patterns which have occurred over years, which can cause then structures of the body, the fascia, to change. And we get into these patterns because the body is always looking for the easiest route. It's always looking for the most comfortable for our own bodies. So with these patterns that are going on, I ended up with a hip hike and tended to sit on my left hip. So my right hip was always elevated when I'm watching TV. And I wasn't aware of it until I looked in the mirror and I thought, oh, crikey, you're a bit lopsided. And that can be corrected. This is the amazing thing about any fitness program. And I strongly recommend anybody, first of all, getting assessed properly by a medical advisor, such as a physiotherapist, gynecologist, going to a really good fitness instructor as yourself, and getting the fitness industry and the medical industry, they really need to start talking to each other because they can learn a lot from each other. And it's all for the benefit of the patient at the end of the day to sort their problems of whatever dysfunction is going on in the body. So I think that's my story. And now I do just training. I don't manufacture anymore, but I do pessary training for medical professionals and advice.
Wow. So I have, two questions just from what you just said. So I was actually really surprised, as you said, that instead of using, tampons, that women should be, looking more towards pessaries. But I'm really surprised at that, tampons have been such a staple for such a long time. It's something that, is sold everywhere. It's sold in locker rooms, women's locker rooms, and gyms all over, and in supermarkets. So I was very surprised to hear you say that. And then secondly, in regards to the uterine prolapse, I know you were talking about the different stages. Comparably to, let's say, cancer, what are the effects of those different stages of uterine prolapse? Is it as dangerous or as deadly as, say, those cancers as they progress stages? Is that something that, as it goes up in stages, that maybe loss of life is something that we should be worried about?
No. See, a lot of people think that their pelvic organs are going to fall out and end up on the floor. The fascia and the ligaments that hold up the pelvic organs, it's stronger than steel. And so your organs are not going to fall out, even if you're at a stage 4. So there are different types of prolapses. So, you've heard of men having a hernia. A prolapse is just that. It is a hernia in the vaginal canal. So it can be the bowel, it can be the intestines up high, which is an enterocele. It can be where the uterus starts to descend down and then the cervix comes down, obviously, with that. So that's your uterine prolapse. You can have a bladder where the bladder starts to herniate into the front side, the anterior side of the vagina. So that's called a cystocele. Anything that's cysto, it means bladder. You can have a urethrocoele, where the urethra starts to herniate. And the nice thing about having a prolapse, regardless what stage you have a prolapse, what type, and you can have multiple prolapses as well. There is a pessary for every type of prolapse, and it's dependent on, first of all, whether you will support your prolapse, a pessary, because there are some contraindications. It's also if you've got a good physician that knows his pessaries or knows her pessaries, and to be able to advise. So, for instance, a lot of women, the first pessary that they will be given is a ring pessary. And that works in about 76% of patients. However, if you have a rectocele, so where the bowel starts to protrude into the posterior side of the vagina, what can happen with the ring? It starts to embed into the prolapse, and then that can stop defecation. So then you've got a whole other scenario going on where the patient says, the ring doesn't work for me. So what I would advise, if anybody's listening and is going through this, is to ask for more of a curvature on the pessary, so like a cup pessary or a dish, so it basically softens that back wall and allows then the passage of stools through without interrupting anything. Sometimes women will go through 6 or 7 pessaries, and they all come in different sizes as well. So again, you may need 2 different types of pessaries. We know we've got a lot of fitness people who are doing extreme sports, and maybe they'll use a cube while they're doing weightlifting, and then they might go back to a ring when they're not doing any sports at all. We can also use 2 pessaries at the same time. So the choice for clients is so great that, it does take time to find that pessary. And I think a lot of times women are being told by the doctor as well, which I've heard a lot, oh, it's only for old people. There's no age limit on the pessary. I've seen people at 18 years old with prolapses. Prolapses can happen as well to anybody. It is all about the structure. So yes, there's a higher prevalence of women who have had vaginal canal births, but it doesn't mean to say that if you've delivered a baby through the vagina, you're definitely going to get a prolapse, just as much as women who have never had children end up with a prolapse. There's a lot of people with hypermobility disorders as well. I don't like the word disorder, I hate that word, but hypermobility issues. Because of the flexibility in the collagen of their structure, they can be prone to prolapses. So again, a good fitness regime can actually help reduce that as well when we do eccentric loading and so on. That's the kind of exercise I would give to somebody. And resistance bands, they're $5 for 5 of them. Use your resistance bands as well to sort of help increase load or get that eccentric load going. So that, those are the little tips that women can do at home without even having to see anybody. But yeah.
Now,
did I answer your question?
Yeah, it does. It does. And I don't want to throw any trainers under the bus, but I mean, have you ever, had any trainers consult you, like say, hey, I'm working with this client, she has such and such, and, I'm not really sure how to program for her, let's say, or they've even gone ahead to do programming for your client, and then when you do start to work with them, you notice that their programming is way off, or it's just like not specific enough to, safely address their issue. Have you noticed that as you've worked with any other trainers who've been, training women with similar issues?
Yeah, we see it a lot with Pilates instructors, and I see it a lot with new instructors who don't necessarily or haven't been trained in pelvic organ prolapse clients. The good thing is that, again, pelvic organ prolapse, when you do any kind of fitness, you're not going to do a lot of damage to your own body. So fitness instructors, I would definitely, advise that you get or do a full assessment on your client first. Always ask the question, do you have any incontinence issues? Do you have a pelvic organ prolapse that you know of? A lot of patients, they don't even know what pelvic organ prolapse is. So again, from a fitness side, when you're doing these assessments, and I'm happy to send you my assessment form, my checklist, I go through the symptoms. And, oh yeah, I've got that symptom, and I've got that symptom. Oh, and then as an instructor, you can never diagnose. That isn't our road. So when I hear these triggers where a client, I think, that sounds as if it's possible prolapse, I will always say, I advise you to go and make an appointment with your doctor, and I would ease off certainly on things like planks, but planks are not bad if they're done properly. And I think I've just taken 15 women through a 6-week program now, and I give free lessons after they do the program just to make sure that they keep up with their exercises. And we're coming into, I think it's week 8 now, and I keep saying, right, now is the time we're going to start adding loads. So I want you to get your weights. And I think a lot of fitness instructors shy away from, they've got the prolapse, they can't lift a weight. The muscle needs loads. It needs loads to get better. And stretching as well. We need to be able to move the sarcomeres in the muscle fibers. So we need that contraction just as much as, that relaxation of stretch. So we do deep stretching. And you'd be surprised how many clients with pelvic organ prolapse after we've done a deep stretching session. So we don't do more than 2 minutes. Minimum of 2 minutes, and a maximum of 6 minutes. But I will, with my prolapse ladies, I just do 2 minutes. And that helps them with the deep breathing to relax their pelvic floor, because we need to down train just as much as we need to up train. Because if we're up training the pelvic floor all the time, then we're going to possibly cause hypertonicity. So again, having somebody with a prolapse, get them to down train at the end of your program, and make sure that they're not, if they're doing deep stretching, make sure they're not operating in machinery, or they're not driving. Basically, once you do that deep stretching, you need a good 2 hours for the muscles then to come back to normal as it was.
So I know as trainers, we take our clients through cycles, right? Mesophases, macrophases, and such.
Yeah.
Where would you say that we would then need to start to up train? I know you said like around the 8 weeks, right? Where we'll push it up, start really putting some load on. And I know that obviously for each client, it's very specific. So where would you suggest there's up training and then down training? And then even in the midst of a cycle, like let's say within the first 2 or 3 weeks, how often would you up train, like vacillate between up training and down training?
I would down train at the end of each session. That is specific to my clientele, and they get rewarded for it. Their bodies get rewarded because they've done all this up training, and now my body gets to go on holiday a little bit, and they love it. I think, as you said, each individual is different. It depends on the age as well. You've got an 18-year-old fit person, and you've got somebody like me, an old crow who's postmenopausal, and sort of my muscles are different to when I was 18, and I need longer to recover after doing an up training session. So again, I think it's really knowing each individual client. You can't really put an umbrella on this, because if your client says, you know what, I've been doing this training now for 2 weeks, I don't feel I can go further with this. Can I have another week of doing that same circuit training? Give it to them. We want to build confidence in the client and not scare them away. So, yeah.
Interesting. Now, I want to kind of shift gears a little bit and kind of go to some audience questions. We have one person here. This is a lady who's in her late 60s. So she had a couple of questions, and I think she's referring to her uterine prolapse. She said, and this is her first question, she said, does this condition limit the type and frequency of exercise that one can do? So that's kind of like her first question. So maybe, I guess I know we've answered it a little bit, but you can probably just try to tackle that question. She said, does the condition limit the type and frequency of exercise that one can do?
Okay, I think it depends on yourself. I always say, we need to push ourselves a little bit further, but we never push through pain. So if you've got any joint pain, absolutely, that's a big no-no. You don't ever go through joint pain. Muscle pain is all right, because it means that we're building up muscle. So it depends on you. Be open with your trainer and modify. I love modifying different movements. One of my clients, for instance, she wasn't able to squat, and she said, no, I'll never be able to squat, with my prolapse, and going down there, it's going to push my prolapse out. So we ended up with a Pilates ball against the lower back on the wall, and we got to squat. And now she's doing full squats. So I don't think the type of prolapse or the size or grade of prolapse should restrict you from the exercise. Just listen to your own body. A lot of the time you will feel more symptomatic after doing exercise, and that's because those ligaments and the muscles have been working. So obviously, hopefully the prolapse will start to come back up as the ligaments get stronger. So the ligaments are bringing up the pelvic organs.
Great. And I think the second part of her question, she said, I have found that since I've been attending the gym, I'm not experiencing the discomfort as much as before when I was not exercising on a regular basis. She said, I do abdominals, a variety of leg exercises that involve pushing weight, torso twists, exercise for my lower back, etc. Would any of these have any adverse effects or strain on my bladder or uterus?
No. As long as we hear the word engage your core a lot, but engage your core, what does that mean? It doesn't mean suck in your belly. Right. It means that basically we're controlling that intra-abdominal pressure as we're doing. I don't like crunches. I tend to stay away from crunches because there's no need for crunches in prolapse women. There are other ways. The torso twists, they are great for the obliques. So, yeah, it sounds like she's doing a great job and she's listening to her own body, and certainly it sounds like she's got a great instructor at the gym. So carry on doing what you're doing.
Okay. So that's really helpful, and I really learned a lot just from this, because when as I said, a family member of mine who's very close to me shared that she had uterine prolapse. It was the first time I had ever heard of it. I knew nothing about it. I wasn't even sure how to help her, and so that's where kind of like my journey began, of like looking into different experts, people who had any expertise in this field. And it's interesting that there wasn't a lot of helpful material, I would say even 3 or 4 years ago, just typing it in on Google, or just doing like a Google Scholar research. in this field, have you noticed that there has been a increase in the, I guess, the knowledge concerning this issue, and that there's more work that's being done on this. There's more papers and articles being written on this.
Yeah, I think there's definitely. I mean, I've got thousands of clinical papers because I use the clinical papers to back up my training when I do training. I think it's getting more and more about the awareness. I think women are standing up for themselves. I think as well that the personal fitness industry has become more aware about this issue, and they're starting to talk about it with clients as well. There's a lot of good websites out there. There's a lot of bad websites, unfortunately, with misinformation. But there's a lot of good websites that will give you information, and I always tend to look at websites. Is it run by a medical trained person? Does this information contain any literature that is backed up by science? So those are the things that I would be looking out for, not just a website that says, here's a lot of prolapses and yada, yada, yada. I think it is a very personal journey for every woman who endures it, that you are absolutely not alone. On record, 50% of women have pelvic organ prolapse for whatever reason, and there's different reasons that they prolapse. I would like to say to every single one of you that please get professional help through a women's health physiotherapist, a good gynecologist who is willing to take you on a pessary journey rather than say, right, let's put you under the knife straight away. Again, from a fitness perspective, and all fitness trainers out there, if you have somebody that's going for surgery, and I'm not against surgery, but there is a place and a time for each person to go in. I would say if you are planning surgery, to have 6 months with a personal trainer to get that pelvic floor strong, to be able to go through the surgery, and then at least 6 months after. Once you have surgery, you should be doing your pelvic floor training 3 times a week for the rest of your life. A lot of people think, I've had the surgery, that's it, I'm fixed. It's not a case of that. Your muscles still deteriorate. You need to keep building that strength, and it isn't all about Kegels. We have a lot of women who grind their teeth, going back to the jaw. A lot of people who are in highly stressed jobs, they're chest breathers. When you do a breathing assessment, I always turn them around and I see how high their shoulders raise when they take a nice deep breath in. That tells me they're not breathing 360, they're just breathing up in the chest. So we need to work on the diaphragm before I do any pelvic floor work with them. And then I've lost my train of thought now. I talk too much, that's my problem. So if you are having surgery, please consider that. Oh yeah, that's what I was saying. We have a lot of stressful people who are hypertonic. So giving them Kegels, giving them high tone pelvic floor exercises is going to make those worse. We want to down train before we up train if you're already tight, like a tightrope there.
And how, in terms of, like, we talked a lot about the condition itself, how would we then go about making sure that, young women now in their 20s, 30s, 40s, that they are doing what they can to prevent things like this from happening, right? Like at a physiological level. And then also, is there any dietary link between, the causation of a uterine prolapse or any pelvic issues?
Did you say a dietary?
Yes, yeah. If there's any dietary link, if there's any science or any data showing that there's a dietary link between, uterine prolapse or any pelvic floor issues?
No, I haven't seen any evidence to date. If you've got any, if you find any, I'd appreciate that. But certainly there's nothing on the dietary side. We know that people are who are overweight, it stands to reason that they would have that extra intra-abdominal pressure coming down. That can contribute to it, but it doesn't necessarily say that that has caused it. So obviously keeping your weight under control, having a good nutritionist like I did, to keep the bowels regular. One of my go-to for people who are constipated is the golden linseeds. I don't know what you call it, something like flax seeds in the States. So you take 2 teaspoons of golden linseeds, flax seeds, and fresh orange juice. So keep the pulp, put it in, mix it up, put it in the fridge until it goes gloopy, mix it again and drink it. And the flax seeds will help lubricate the intestines, and it will help them regulate the bowels. I wouldn't do it every day. I only do it if I'm feeling a little bit bunged up or constipated. But, looking at your diets, again, looking at not just your sugar levels, because, you're overworking the pancreas if you've got too much sugar going through your body. And it doesn't mean that you've got to stop tomorrow, because if you're used to certain foods, we want to wean you off those foods. We don't want to go cold turkey because, you've been drinking, let's say, 5 cans of soda every day, and all of a sudden, no, I'm not drinking anymore. So cut down until you can cut out.
So mostly in terms of like preventing it, you would say that there's more like physiological work that goes into really preventing, such pelvic floor issues.
I think prevention is better than cure, and I think if we can start even at school age, start looking at the pelvic floor, strengthening the pelvic floor, the core as well. I mean, we're looking at the glutes here, then we're going down to the hamstrings. We want the whole of that posterior and anterior chain to be functional. We want to be able to work the body parts and the nerves as well to interact with each other, because if one is misaligned, then you're working against the grain. So knowing how to look after your body is certainly, a good measure of being preventative for sure.
Well, Gaynor, this was definitely very insightful. It was definitely very helpful. Again, I've learned a lot. And, even though that this particular episode is really geared towards helping women who are probably going through this issue or are not aware of this issue at all, I think even, husbands and spouses and, sons, you should also be aware of this information so that they know how to help, their loved ones. So I really think that this is definitely pivotal, really important. And I'm glad that, you're doing a work to really highlight that. And more than that, you're creating the devices that are going to help. And I guess speaking about those devices, are there, I know you said there's a list of devices that you've made and created. Are there, besides the Pessary, like other devices that you would suggest if they're not able to get a hold of the Pessary?
So if you think of a Pessary as an internal sports bra to hold up the prolapses, so the other products that there certainly are available on the market are pelvic floor strengthening, but again, please make sure that you're not in a high-tone hypertonic state, because using those internal devices to help strengthen the pelvic floor can make you more high-tone. There's a lot of good support garments out there, and lucky for you guys in the USA, in my opinion, you guys are the leaders in support garments. There's a couple in Europe which I favour, but the majority of support garments for pelvic organ prolapse are made in the States. So it's right on your doorstep over there. I would advise anybody that has a pelvic organ prolapse and who doesn't have a pessary yet or can't have a pessary, please do invest in a good pair of support underwear. And again, don't be afraid to talk to the people who are selling these. Even get hold of the manufacturers and say, look, I've got this type of prolapse. What underwear do you suggest I have? Because there's different underwears available, different prolapses as well. It shouldn't cost you a lot of money to support the pelvic floor. So these companies that are charging $400-500, there are companies which have got just as good products at $70. So again, don't think because the product is more expensive, it's better. It's not.
All right, well, there you have it, guys. And this is the part of the show that I, allow the guests to let the audience know what they have coming up next, and also just to share their socials so that we know where to find. So again, definitely take this time to let everyone know what you have coming up next, and also let us know where we can find.
So, 29th of February, I've got the Pessary training on Zoom with the portal with all the clinical data. And there's also a talk on toxic shock syndrome, which I did using C-sponges and all sorts. That's on the 29th of February. That's a 12-hour CPD course, runs for 3 weeks. Twice a year I do my Pilates training. So we've just had one, so the next one will be in October. I've got a Facebook group which is called Pessaries and Pelvic Organ Prolapses, and that's a closed group for females only, for obvious reasons. And you could follow me on social media under Pelvic Angel, and anybody who wants to reach out, I've got a plethora of medical advisors. So if you're in a particular area that you can't find a physiotherapist, I can have a look on the list to see if there's somebody suitable near you as well. So yeah, always happy to help.
Great. Well, Gaynor, I really appreciate this helping us. She's helping us all the way from Brussels, all the way in Belgium. So we're really thankful for what you shared today. And again, this is the I Choose Health podcast. And again, I was making it appeal to you to make the choice to be healthy, make the choice to be you. And just, always take this information that you have here, that you've heard here, and really apply it. See how it's going to, not just add years to your life, but add, quality living to not just you, but those around you. So again, this is I Choose Health podcast. Host Stephen Leslie. Hope you guys have a great